Hey, I'm Teresa. I'm a dental hygienist. I've been doing this for 40 years. I had a really bad experience as a child in the dental chair. Was not very good at my home care. When I was 16 years old, and instead of my hygienist preaching at me, she actually taught me how to take care of my teeth. Through the years, I have learned tips of the trade. I'm going to teach you how to take care of your teeth and make your dental experiences a much healthier and happier place. Hey, thanks for watching. Welcome back. I hope you're enjoying the videos thus far. Today we're going to talk about babies and being pregnant, and that there's a myth out there that babies took all the nutrients out of my teeth. That's why they're rotting out of my head. That is a myth. There are some things to do while you're pregnant to keep yourself healthy as well as your baby and your teeth healthy. The first thing you're going to do is welcome to pregnancy. Your hormones are going to change because you have just become pregnant. So you're going to notice in the first trimester that your hormones have changed because you're pregnant. So you might notice some puffy gums, some bleedy gums. During the second trimester, your body's kind of getting used to the situation of being pregnant, so things will calm down a little bit, maybe not so much morning sickness. By the third trimester, your body is getting ready for delivery, so you're going to notice a lot more changes of hormones in there. So your body is getting ready for delivery. You may notice some more puffy gums, more sickness. So I want you to just keep your mouth as healthy as you can. Use your electric toothbrush, your xylitol products, flossing every day. Even though it's bleeding, keep doing it, because more than likely it's hormonal after the baby is delivered. Then you will notice that things calm down. If you get sick during your pregnancy, which almost every mother does, if you don't, lucky ladies if you don't. Morning sickness. If you throw up or regurgitate, what you're doing is most people will brush the acid, or they'll brush their teeth right after, and it brushes the acid into their teeth, and that's what dissolves the teeth. If you get sick, I want you to rinse your mouth out with water, wait 20 minutes, and then brush your teeth. What you're doing is you're neutralizing that acid, so you're not brushing it into your enamel. If you can use baking soda, that'll help neutralize your mouth as well. Use your fluoride rinse after. Wait 30 minutes because that fluoride will be help hardening things up. Use MI paste. MI paste is natural. You just take a pea-sized portion, put it on your teeth, smear it around with your tongue for 3 minutes and swallow it. It's got calcium for your bones. It will also help keep your mouth a neutral 7 for 3 hours. Ginger is a natural remedy. No more than 1 milligram a day, and that is a natural remedy to help keep your stomach soothed and not having morning sickness. On the ginger, you can cook with it, you can make it into a tea, or just place a little bit in your mouth and go for it. I like to have it in a tea. Just place them in, boil it for about 10 minutes, and then you're gonna let it steep, cool off, strain it, and then use it as a tea. And you can put some flavoring in, like natural flavors like honey or maple syrup in there to help with the taste. But that'll help soothe your stomach as well. Okay, periodontal disease. If you have periodontal disease that is untreated when you are pregnant, you have a risk of low birth weight babies or premature deliveries. Please see your hygienist at least once during your pregnancy, as well as even if you're healthy, you want to see your hygienist at least clean your teeth once. Sometimes you have to do it every 3 months because the hormones can be really crazy. So that's just something that you're going to discuss with you and your doctor and your hygienist. Pregnancy gingivitis is very normal. You're going to brush your teeth at least twice a day with your electric toothbrush. You're going to hold it at least 5 seconds each tooth. Sometimes you may have to hold it 15 or 20 seconds to just get that vibration in there and break up that bacteria underneath your gums. Keep those gums as tight as you can. Make sure you're flossing every day. I know that the F word, flossing, is not a good word, but it is a very important word. And you want to seesaw it in, hug the tooth, break it up and down. If you see goop, wipe it out, go back in until it's goop free. You'll find goop on the lower front and on the upper molars. Eat more frequently in smaller portions. That can help soothe your stomach as well. There are some foods out there. Everybody is different. I have some people that can eat anything during pregnancy and it doesn't bother them. When I was pregnant, I could not eat sugar. It made me sick. So needless to say, I had a really healthy pregnancy. But everybody is different. Sometimes it's some people, if they smell grass, it makes them sick. Or if they eat a certain food, just kind of pay attention to what you're eating. Your body's communicating with you. Stay hydrated. Even though you're eating small portions, there's not enough room in there. You want to keep your mouth as healthy as you can. Hydration is key because it helps get rid of all the impurities in your body. Proper nutrition is essential for you and the baby. When you are not eating properly, the baby can take nutrients from your body, like your bones. It can take calcium for your bones. It will not take it from your teeth. Your teeth have been already formed. They're in your mouth. The reason you have problems with your teeth is because you're throwing up and you're brushing the acid back into your enamel, and that's what dissolves your teeth. And a lot of people will have acid reflux because there's not enough room when the baby gets bigger, that you will regurgitate because the stomach is so small, or so just eat more frequently. Eat healthy foods, make healthy choices. You want to eat all the good things that you ate before. Soda is probably one of the worst things that you can eat when you are pregnant because it's going to dissolve your teeth because of the acidity. Watch that video with all the acidities in your different drinks. But the important thing is that you want things that are going to help build your bone support in your system so the baby can take those nutrients from what you are eating and not from you. So when you are 8 months pregnant, you will probably more than likely have to eat more frequently because there's not enough room to eat, and hormones are getting ready to work, and you are at the highest risk for tooth decay and periodontal disease at the 8 months. So kind of pay attention on that 8-month mark to really be extra careful in your mouth and do all the extra things that you can to keep your mouth as healthy as you can. And chew your Trident or ice cube gum with your xylitol. That'll help too. Okay, I hope these help, and don't forget to brush the subscribe button. I hope you're enjoying this. Thanks for watching.